Okay, so it's 9 o'clock. Knock knock. I'm gonna wash my hands. Hi, I'm Tim. I'm your student nurse for today. Can you please verify my name and date of birth?
Evelyn Blake, December 2, 1994.
Okay, great. So I'm here to set up your IV bag with your medication. Does that sound okay with you?
Yeah,
Okay, great. So before we begin, are you allergic to anything?
just penicillin.
Okay, so I'm going to set up your no more saline. So no more saline will help you prevent from getting dehydrated. Side effects can include nausea or vomiting. And then with your medication, which is ceftriaxone, it's an antibiotic. This will help prevent any bacterial infection from contracting. Does that sound okay? And side effects should include nausea and fever and vomiting. Does that sound okay with you?
Yeah.
Okay, great. So I'm gonna go ahead and get your medication. The race is, go ahead and get my medications now. Wash my hands. Okay, so I'm at the med cart. I'm going to do my first check. So I'm gonna type in ceftriaxone. So it says 1 gram in here, and then on my MRR it says ceftriaxone 1,000 milligrams. So that's good. Okay, now I'm gonna look at no more saline. And then it says no more saline on the computer as well. Okay, so now I'm gonna type this in, get my medication. So I have this now. So I'll make sure this is the right medication. No more saline. No more saline, that's good. Okay. So now I have ceftriaxone, 1 gram, and it says ceftriaxone, 1,000 milligrams. So that's perfect. Okay, I'm gonna get my supplies I need to set up my IV in my IV piggy bag. Okay, and now I'm gonna close the cart. Go. Okay, and I'm gonna go back to the patient's room. Hi, I'm Tim. I'm your student nurse. Can you please verify me your name and date of birth?
Evelyn Blake, December 2, 1994.
Okay, great. And what are you allergic to?
Just penicillin.
Okay, so I'm gonna go ahead and compare your medication. So I'm gonna put on the gloves. Okay, so now I'm gonna make sure that this is the right drug. This is indeed is with my third check. Now I'm gonna see if there's any sediments, any clumps in here. There is it. I'll make sure this is intact, no drainage or leakage in this IV bag. Okay, and then the water, the medication is clear. And now I'm gonna look at the expiration date, 2028, so I can use this. Okay, I'm gonna get this from a new bag. So now I'm gonna open it, and now I'm gonna spike it. Okay. Okay, and then now I'm gonna clamp 1, so no medication comes out. Okay, I'm gonna look at the other ones, see if they're clamped, which I don't need. I'll just keep one of them clamped up. So now I'm gonna hang this.
This is not even plugged in yet.
Okay. Now I'm going to prime it. Make sure I'm hanging with this. Okay. So now it's good. I'm gonna fill this up halfway. Okay, now I'm gonna unclamp it so I can prime this. Now you should see it flow. Okay, there it goes. So now I'm gonna look for any air bubbles, make sure there's none left. Okay, and now there's no more air bubbles, so I'm gonna clamp this now. Okay, so now I'm gonna set this up, turn on the pump. Open this. Okay. So now I want to set this up. Is this a new patient? Yes. Yes. Patient entry. 1, 2, 3, 4. Click confirm it. I'm going to select channel A, basic infusion. Rate is at 100 milliliters per hour because that's what the MAR is asking for. And I have 1,000 milliliters in my IV bag, but I'm going to put 900 to make sure that I have time to switch it. Okay, so now I'm going to press start, and then you're going to look and see that this is dripping. So, I'm going to unclamp this. Now you can see that this is dripping. As you can see, the medication is going, so we're good. Okay, so yeah, we're good now. So now I'm going to set up my medication. I'm going to set up ceftriaxone. So now I'm going to dice it as well. Make sure this is the right drug with the MAR. It is 1 gram with 1,000 milligrams. Make sure that this is intact, there's no drainage. Okay, make sure the color is clear. See if there's any sediments, no clumps. Okay, and now I'm going to look at the expiration date, which is 2022, so I can use this. Now I'm going to prime this, or I'm going to spike it now. Open this bag to get the secondary infusion tubing. Take this off.
Now I'm going to do the secondary now.
Now I'm going to spike it. Okay. Place this here. Place this. Now I'm going to wipe this with alcohol.
So we just started the primary infusion, so now we're going to start the secondary, which is the
Okay, now we're going to prime this with back foil. I'm going to unclamp this because it was clamped before.
So first I'm going to open the IV set.
So now you can see, I'm going to make sure there's no air bubbles. As you see, this is filling up. Okay, and I don't see any more air bubbles, so I'm going to go ahead and clamp this. Okay, I'm going to hang this up again. Now I'm going to lower this IV bag so that this will stop dripping, and it's going to start dripping with this one. Okay, so now I'm going to put channel select, secondary.
So now I'm going to.
I want to pick ceftriaxone, 1,000 milligrams per 50 milliliters. That's what we want. Is that the right one? Yes. Now I'm going to start it. Okay, now I'm going to unclamp the antibiotic medication. Now this should start dripping. And as you can see, it's dripping now, so the secondary infusion is going. Okay, so I'm done. I'm going to clean up my area. Okay, Evelyn, so I'm done with your medication infusion. So this should come in effect in about 15 to 30 minutes. Is there anything else I could do for you?
No, not really.
No? Okay, so if you need anything, here's your call light right there. Okay, now I want to make sure your bed is locked in the lowest position. And let's go ahead, take off my gloves. Now I'm going to put the railing up for safety. Make sure the bed's locked, okay? And then it's at the lowest position. Now I'm going to clean up my station, wash my hands, and then report and record. I'm going to record right now. So, okay, I recorded on my MAR, so now I'm going to wash my hands and leave after my station was clean.
Hello, my name is Katrine. I'll be your student nurse for today. May I please have your name and birthday?
Evelyn Blake, December 2, 1994.
Okay, Evelyn, thank you. So today I'll be here to administer your Foley catheter. And have you had this done before?
Yes.
Yes, so you do know it might be a little uncomfortable and painful, but I'll try my best to make sure you don't experience a lot of pain with this today. I would also like to ask, do you have any allergies that I should know of?
Penicillin.
Just penicillin and not latex or anything, right?
No.
No, okay, perfect. So I'm gonna go ahead and just set up your bed real quick. Okay. And then let's wash my hands here first. Make sure the bed is on my waist level. And then I already have your bed all set up and ready. Okay. Yeah. Alright. You have it right beside me. And do you mind if I move down your cloth here so I can have better exposure?
Go ahead.
Thank you.
Because I always put it in my back, put them in my backpack.
I mean, you can like send
And I'm gonna go ahead and lift out your gown if that's okay with you too.
Okay.
More covered here. And set your foot up into Sims, okay? So I'm just gonna lift up your legs here and bend it. Have it open for me. Thank you. Okay. Alright. Are you feeling okay right now?
Yes.
Yes, it might be a little uncomfortable, but I'll try to get it over with, okay? But before I go ahead and do that, I'm gonna just do some perineal care. Make sure you're all clean before I start the Foley catheter, okay? And then I would go and start my perineal care right here. Alright, and after that, just take off my gloves. Now I'm going to set up my sterile field. So I'll have my field set up here. Sure, in the right spot. Okay.
When does it do? Tuesday?
So I have my kit here already. Just going to set this up here. Okay. Making sure I don't touch the insides, just the 1-inch border. Here I have my brand new sterile gloves. Okay, so I have my gloves all set up and just set up my cloth here. Alright. And I want my shiny side down.
Alright. So I'm gonna keep them clean, raising the hood until I pass everything out.
Okay. Alright, and now I'm gonna move my tray over. Okay, I have my swab sticks here. Just gonna set this down. Alright, and just open this up here.
And now I get hygiene on my hygiene.
Alright,
And I get a new set of gloves.
and you get the lube. And now I'm just gonna put this into the lube and set it there for a moment. Go ahead and get my syringe. I'm gonna remove the cap. And go ahead and insert this. Okay, I'm just gonna leave that there for a bit.
I'm gonna attach this tube. Get a stapple. And I'm going to the bag. Like the side of your bag. And then I'm gonna go ahead and let urine flow out.
So now this is gonna be my dirty hand. I'm gonna go ahead and just go ahead and push this open here. I'm gonna go ahead and swipe this on the left. Throw that away. swap a second one on the right lip, throw that away, and now one down the middle, and throw that away. So keep this open. I'm gonna get my lube again, make sure it's all lubed up. All right. Now I'm gonna go ahead and insert this. Okay, and I will go ahead and go all the way in until I see urine coming out.
Okay,
And-
urine's coming out.
Okay, urine's coming out, so I'm gonna go in about an inch more. Okay, so after an inch more, I'll stop there. Now I'm just gonna go ahead and inflate the balloon. So here I would go all the way in with all the liquid, so 10 mLs of all of this here. Okay. Alright, so I have all that there. Just go ahead and remove this. I'm gonna toss that away. So we're all good there. I'm gonna go ahead and remove this. I'm gonna take off my gloves.
The procedure is good, and it's not as painful as it is when I'm
Toss that away. I'm just gonna go ahead and put my clean gloves on real quick so I can go ahead and clean you up. Okay. My other gloves. Okay. So if at that point any urine spit out, I will go ahead and clean up the area. I would also go ahead and just get my bag here. Okay. And attach this onto your left or right thigh here with a stat lock, and I will go ahead and hang the bag down here with the hook and label the bag with the date, time, and my initial as well. Okay, and I will let that collect urine for about a few days until I come back and check that again. Okay, and then I'm just gonna go ahead and clean up the area here as well and put you in a comfortable position once more. Okay, so a few days has passed and I'm back here to collect the urine sample and from the urine bag. So I'm gonna put my sterile or clean gloves on. And then, okay.
I will look
And
at how much the urine is, measure the urine, and document it. And then I will throw away the bag.
so now I'm gonna collect some urine sample. So I have my tubing right here. I'm gonna go down to the bag that I filled up for the past few days and just measure how much I collected here first before I go and do this. And open my cap here. Go ahead and this and open the port and collect however much I need. And then close it when I have enough. Alright. And seal this back up. I'm gonna close this, and I'm gonna label it and initial and send it to lab as well. Okay, and also now I'll just take out your Foley catheter. It's been a few days past. I'm gonna go ahead and deflate the balloon that I inflated just a few days ago. So I have an empty catheter syringe here. Insert that in. I'm just gonna go ahead and deflate the balloon. Okay, I got all the water out. I deflated the balloon. Just go ahead and pull it out. Okay. Now I would go ahead and just toss this along with whatever else I need to toss away. So now I'm going to go ahead and just clean up my station here, and after that I'll go ahead and document whatever else I needed to document.